So the question is, how do I get my Wellprept pages to the patients? So let's talk about that. There are 7 ways. Just think about this timeline here. We have the point of care, we have before, after, and there's this time when they're sort of sitting in the waiting room or getting roomed right before the point of care when you see them. Or this could be the emergency room, or let's think of the point of care as somewhat loose. So there's 3 ways to do it before the point of care. And this is really the ideal scenario, to try to get it to the patient before you see them. And there are 3 ways. So the first way is right here. We are going to try to get your administrative assistant, or some people have nurse navigators, that's somewhat of a luxury. Try to get the person who does the scheduling to email a patient or somehow tell the patient, please go to this URL if you're seeing Dr. Smith for this condition. This takes some instructing, but it's well worth your while to make this consistent. And you may want to do all 3 of these things. The second thing is, when you prep for clinic, you see your new patients, you email the patient, and patients don't abuse this. And you can template this out. I know you're seeing me in clinic. Please review the videos and resources on this page prior to your visit. Looking forward to seeing you. And the third layer is to use Doximity one-way SMS to send a message to the patient. And, ideally you do all 3. It only takes literally 10 seconds to do this, but whatever you feel comfortable. I'll show you how to do the Doximity now. So what you do is you open your Doximity app, you type in the patient's cell phone number, which should be in your medical record, and look in the lower left-hand corner, send text. You can create templates for all the conditions. So you can see blood in the urine, BPH, etc. I create them for all my pages, and each one says, in advance of your visit, please review the materials and resources I created. You drop in the URL. You'll find videos to watch and resources to read and review. And then you send the text. That's it. It takes 2 seconds. Now let's talk about when they're sitting in clinic, either in the waiting room or they've been roomed. It's good to print out a stack of paper with your main QR code. And if you want to get fancy, a stack of paper with all of your QR codes for individual conditions. Some early users have printed their business card with a QR code, something in the clinic that's physical, showing your QR codes to get the patients to look at the appropriate area. So here's an example of a simple PDF that I made that you can make, or you can please email me and I'll make one for you. Dr. Smith's resource page. This is a web page I made for my patients. Please use this on your phone or desktop and visit when you have time. You can easily call my office, get driving directions, get access to some of my favorite educational resources, and have access to my handouts. And then, some patients are going to scan, some want to type it in. You give them both. Print out 100 of these and keep it in clinic. Also, print out a page where you copy and paste all your individual QR codes and the URLs to have this sitting in clinic. Also works really well. Let's talk about what you can do face-to-face. You can log in on your phone to your Wellprept dashboard and show your QR codes. Or, of course, you could show those pieces of paper to the patient. Let me show you how to do the QR codes. So what you do is you log in on a Chrome browser or a Safari browser in your phone to app.wellprept.com, log into your dashboard. So you're physically there with the patient holding your phone in your hand. And this is designed to have your main QR code front and center, and you just show that to your patient sitting next to you. You can also share QR codes for your individual pages directly, which is pretty cool. So here I am logged in. If I want to share, you see on those tiles on the right, you click share. So I can share the code for kidney cancer, for example, or I can share the code for kidney stones for a patient with stones right next to me, or my main code right at the top. And then there's after the point of care, you can template in phrases and QR codes into your after visit summaries so that you can, with one click, send patients off with the appropriate Wellprept page. If you need help with this, please let me know.